Pulse is 80 beats per minute. It is regular and of high volume. Blood pressure is 120 by 60 millimeter of mercury. JVP is not raised. On examination of the pericardium, there is a visible impulse at the mitral area. There is no scar, bulging or any deformity present in the pericardium. The apex beat is displaced in the sixth intercostal space lateral to the midclavicular line. It is thrusting in character. The systolic thrill at the left subclavicular area and a left parasternal heave are palpable. The systolic thrill in the left subclavicular area and a left parasternal heave is palpable. The first heart sound is normal and pulmonary component of the second heart sound is loud, or the first heart sound is normal and second heart sound is not appreciated due to the murmur. There is a continuous machinery systolic murmur with systolic accentuation, heard loudest at the left subscapular area or posteriorly on left upper sternal edge. The lung fields are clear to auscultation. There is no peripheral edema, cyanosis, and clubbing. There is no stigmata of the infective endocarditis. My diagnosis is patent ductus arteriosus with left to right shunt. The shunt is hemodynamically significant because